Child abuse is when an adult inflicts harm on a child. Now, this can be via acts of omission or via acts of commission. Now, what are acts of omission and commission? I have already taught you under the topic of infanticide, but just to revise, acts of omission are those acts that are omitted or not performed by the caregiver that eventually leads to harming the child. For example, after birth, the caregiver is supposed to clear away the airway. After birth to the baby, the caregiver is supposed to provide nutrition and food. The caregiver is supposed to protect the baby from hot and cold and various accidents. All acts of neglect, they fall under acts of omission. Acts of commission, on the other hand, refers to all those activities that are performed by the caregiver that ends up harming the child. For example, strangulating the child, beating the child, suffocating the child, throttling the child, drowning the child, poisoning the child, providing medications that are unnecessary for the child. All these activities will end up harming the child, and this is child abuse. Child abuse, it's of 4 types. You have physical abuse, mental abuse, sexual abuse, and neglect. In this module, we are going to learn about physical abuse in detail, specifically about a syndrome that is very important from both examination, theory examination, and entrance point of view, that is battered baby syndrome. What is battered baby syndrome? Definition. Battered baby syndrome is nothing but multiple repetitive physical injuries inflicted on a child by the child's caregiver or parent or guardian. And what is very important is that these injuries are not by accident. So there's a child and then there's the caregiver, parent or guardian of the child. They multiple times, continuously, repetitively inflict physical injuries to this child, and these are not by accident but an intentional act of child abuse. This is battered baby syndrome. Now, certain child are more susceptible to battered baby syndrome. On the other hand, certain caregiver are more likely to commit battered baby syndrome. Who are they? So the susceptible child are: number 1, boys are more susceptible than girls. Number 2, the youngest or the eldest is more susceptible. Number 3, illegitimate child is more susceptible. Number 4, mentally disabled child is susceptible. Physically disabled child is also susceptible. Underperforming child, or maybe the child is performing well, it's just that the expectation of the caregiver is way high. Underperforming. On the other hand, what type of caregiver are more susceptible to commit battered baby syndrome? Very classic, chronic alcoholic parents. You might have seen in Indian movies, chronic alcoholic parents, they drink all day and all night and then come at night and then beat their child. Then drug abusers, single parents due to pressure. Similarly, unemployed parents, again due to pressure. Very important, parents who have PTSD for child abuse of their own, that is, parents who were abused as a child themselves. So these are the various characteristics. Now let's say parents bring their child to you with injuries. As a doctor, what are the clinical features that you can notice in the child that will suggest battered baby syndrome? The clinical signs are, so the clinical features that suggests battered baby syndrome are: number 1, multiple injuries at different stages of healing. So you will be brought with a 2-3-year-old child, and this child, upon examination, you find has multiple fractures all over the body. But the surprising thing is that these fractures are at different stages of healing. That means these fractures were inflicted at separate days. That means these fractures were most probably inflicted intentionally. That means this child probably is a victim of battered baby syndrome. So you have to use your brain that way. Or just surface injuries, you will see lots of cuts, bite marks, fingertips, cigarette burns, bruises, and they are at different stages of healing, as if someone close to them is inflicting it to them on and on different days, on different events. Number 2, and very important, is that the history doesn't match the injury. The parent will say that my child was playing football and all of a sudden he fell on grass. But then there's a huge hematoma on his brain and fracture of the skull. Just by falling from one's own height, there's not going to be fracture that easily. That means they are fabricating the history. The history is not matching the examination of the injury. Something gadabadi is there. Number 3 is delay in visiting the hospital. Upon examination, it is pretty clear that the injury is 1 week old, but then the parents are bringing their injured child, and now 1 week later. Why is that? And number 4, the child is timid, undernourished, seems scared near parents. This simply the attitude of the child, the psychology of the child, the decubitus of the child, the state of the child tells a lot about abuse. So that's child abuse and battered baby syndrome. But for examination, what you need to know in detail is or are the signs of battered baby syndrome. Starting off with surface injuries. First, in the face. So in the face, you can notice slap mark. You can notice raccoon eyes due to head trauma. You can notice perioral injuries like lip laceration or detachment of lingual frenulum. Detachment of lingual frenulum. Okay, you get it right, lingual frenulum. Then if it is a case of throttling, then there are going to be nail marks, nail abrasion, and sixpenny bruise. All these signs just in face itself. You move downward to the limb, you can see butterfly bruise. Butterfly bruise is as a result of, come on, you have already studied my lecture on mechanical injury. What is butterfly bruise due to? It is due to pinching. Then fingertips mark, because the caregiver held the hand too tightly like this. And then cigar burns, pretty classic. When you examine the abdomen or the back, you can see belt marks. You can see hot iron marks. There are many more. You can imagine the various ways the abuser can inflict surface injuries, bruises, laceration, cuts, all of that. Second is something called the second baby syndrome or the infantile whiplash syndrome. Here, the caregiver is irritated, and what they do is take their infant and then shake them vigorously to and fro because they are irritated with the infant. As a result, the head, it bobs to and fro violently, and the brain inside shakes to and fro violently as well, and that will lead to various injuries related to the brain, characterized by the triad of subdural hemorrhage. You already know this from head trauma. Whenever there is acceleration, deceleration, to and for head movement, it leads in rupture of the breathing veins that leads to subdural hemorrhage. It can even lead to retinal detachment. or encephalopathy. Encephalopathy. This is what I mean. See, the baby is held and then shaken to and fro by the irritated parent. As a result, the brain inside also moves to and fro. There is acceleration, deceleration injury, which leads in rupture of the breathing vein, resulting in subdural hemorrhage, striking of the brain, resulting in encephalopathy, and retinal detachment or hemorrhage in the retina. Next, you have scald. So you saw surface injury, you saw infantile whiplash syndrome, and third, you have your scalds. Scalds are burns due to hot water. See, either the scalds can be accidental or intentional. If it is accidental, you will see one thing. It's most probably gonna be unilateral on one side, as if the baby has genuinely fallen into hot water accidentally, and there is not gonna be proper line of demarcation. Because proper line of demarcation is going to be there if the baby is held in hot water for a while. Then there will be a proper line of demarcation. If it's by accident, the baby is going to feel the burn and then it's going to move and then get out of the water. So there's not going to be proper line of demarcation. On the other hand, in scald burns inflicted by the abuser intentionally, what they are going to do is take the baby, put the baby in hot water and hold it there. As a result, there's going to be bilateral involvement and a clear line of demarcation. Now, there are two ways the abuser can hold the baby in hot water. Either dip the baby in a flexed position like this, or just dip the hands and foot of the baby. If they just dip the hand and foot of the baby, that will result in glove and stocking appearance. But on the other hand, if they fully immerse the baby in the tub in flexed position like this, then you will be able to appreciate these zebra stripes. Why are there zebra stripes? Due to the folding of the skin. Only those part of the skin that are in contact will get burnt, and the part of the skin that is protected from the water due to fold will be spared. So you will get zebra pattern. Plus both sides are involved because it is intentional. Second, there is a clear line of demarcation because the child is being held inside, not allowed to move. And fourth, the part of the buttocks that is in contact with the bottom of the tub is spared, right? There is no contact with hot water. So that much part is spared. This is donut sparing. So zebra pattern, bilateral involvement, clear line of demarcation, and donut pattern, donut sparing. Visceral organ. There can be lacerations and contusions in visceral organ as well. Next is fracture, very important. See, the most common bone to get fractured as a result of child abuse are your long bones. And the fracture is of two types. You have non-specific fracture, which could be due to child abuse, or may not be due to child abuse. And you have specific fracture that suggests that this is most likely due to child abuse. Non-specific fractures are your buccal fracture due to compression in the axis, spiral fracture due to twisting, and transverse fracture due to perpendicular force. But what is specific is the classic metaphyseal lesion, also referred to as the bucket handle fracture, present at the metaphysis. And at the metaphysis itself, if you see a corner avulsion, a part of the metaphysis at the corner is avulsed, then that is also specific of child abuse. Second, ribs. In ribs, if there is antero-posterior compression, the child is being compressed against the wall, compressed against the floor antero-posteriorly, then the fracture is going to be along the mid-axillary line. Pretty evident. Just imagine the child is being compressed from forward and backward. The highest tension is going to be in the middle, and in the middle is the mid-axillary line, and that's where the rib is going to get fractured. But if the pressure is being applied laterally, then the fracture is going to be on the posterior part of the rib. So lateral compression will lead to fracture on the posterior part of the rib. So antero-posterior compression, mid-axillary line. Lateral compression, posterior. Imagine this to be the child, right? So in second baby syndrome, I hold the child, the infant and shake it vigorously to and fro like this because I'm irritated. That will lead in infantile whiplash syndrome. In fracture, here are the ribs, all the ribs like this. I'll compress from anterior posterior. The highest tension is where? Again, highest tension is here along the mid-axillary line. But if I compress laterally, highest tension is where? Behind, posteriorly. And that is why when you take the X-ray of the child, you'll be able to appreciate string of bead appearance due to the formation of callus. What is callus? For that you need to know about the healing of bone, healing of fracture, which I have already taught you in a different module. So you can check that out. So you can see these calluses in the form of string of bead appearance suggesting child abuse. Then in skull there is eggshell fracture. Okay, let me revise everything once. Okay. So number one, there are surface injury. In surface injury, in face, raccoon eyes, slap mark, lip laceration, lingual frenulum detachment. In the neck, nail marks, sixpenny bruise. In the hand, butterfly bruise due to pinching, fingertip marks or cigar burns. In the abdomen and the back, belt marks or hot iron mark. Second is infantile whiplash syndrome. Infant is shaken vigorously. There is acceleration, deceleration, injury of the brain leading to a triad of encephalopathy, subdural hemorrhage, and retinal detachment. Number 3 is called when the baby is immersed in hot water. If hand and feet are immersed like this, there will be clog and stocking appearance. If the baby is fully immersed in tub in flexed position, then 4 things. Number 1, zebra pattern in the abdomen. Number 2, bilateral involvement. Number 3, clear line of demarcation. And number 4, donor sparing at the buttocks. Number 4, the visceral organs. There can be lacerations and contusion in the visceral organ. Number 5, fractures. So the most common bone to get fractured due to child abuse is the long bone, especially the femur, where you can have non-specific fracture and specific fracture. The specific fracture is bucket handle fracture and coronal avulsion at metaphysis. In the ribs, if there is anterior-posterior compression, there's going to be fracture at the mid-axillary line. If there is lateral compression, there's going to be fracture at the posterior medial part of the rib. And this under X-ray is visible as a string of calluses. In the skull, there can be eggshell fracture. Manchausen syndrome by proxy. Manchausen syndrome is fabricating illness by proxy, that is on someone else. You are fabricating illness but not on yourself but on someone else. A typical case, don't look at the note right now, listen to me. This is what a typical case of Manchausen syndrome looks like. So there's a mother with her daughter. The mother fabricates illness in her daughter. The daughter is fine. She doesn't have this disease. But the mother fabricates the disease in the daughter to a point that even daughter believes that yes, she has that disease. And she is so grateful that her loving mother is taking care of her despite of her having that disease, when in reality, the mother is abusing her. In reality, the child is fine. The child's life is being made hell by her mother. The child does not realize that or may realize that later on. But it's not just the child, but the public also that gets played. The public also thinks that, wow, such a loving mother she is, such unconditional love there is. Even though the child has that fake illnesses, she's taking care of her child. She's not leaving her child. But in reality, what is happening? In reality, the mother is fabricating the illness in the child does not even have. And why would she do so? Pretty clear. She does so for number 1, attention. The public is giving attention. Number 2, sympathy. The public is going, oh, such a good mother. Oh, we should help her. Number 3, the public gives money. I hope this money helps you out, donates money to her. And number 4, for praise. Wow, such a great mother, such unconditional love. She's taking care of her daughter so much. That is Manchausen syndrome by proxy. So what is it? It is fabricating disease in one's child for attention, money, sympathy, and praise. Now, how can the mother fabricate disease? Number one, by making up symptoms. Like the mother will take her child to the doctor and then give false past history of seizures, fever. The child never had seizure. The child never had fever. The child was all right, but she makes up stories that yes, my child was sleeping, all of a sudden she had seizure. My child was sleeping and she was not able to breathe all of a sudden. So making up symptoms. Number two is giving unnecessary medications. Even though the child is fine, she is giving medications to the child. Sometimes to fabricate illnesses, like she would give emetics to induce vomiting. She would give laxative to induce diarrhea. Number three, altering lab samples. So to urine sample, the mother will add blood to induce hematuria, poisoning the child. So giving small doses of poison through food so that the child is continuously sick. Causing suffocation, intentionally suffocating the child to induce respiratory illnesses. Withholding food, giving little food, depriving child of the food, or telling child goes, "Mommy, can I eat that?" The mother goes, "No, you can't eat that. That's going to kill you. That's going to harm you." When in reality, that food is not going to do anything. "Mommy, can I have a piece of candy?" The mother goes, "No, you can't have that piece of candy, baby. That candy is going to suppress your immune system." What? That's not even reality. But then that's what she induces, making up false stories, lies. So how can you detect such a case, right? You can detect it by 4 ways. Number one, you will always find a doctor shopping. The mother will take her child to multiple doctors at different periods so that one doctor does not raise suspicion, to avoid suspicion. Number two, past history of multiple hospitalization. The mother will make up stories, make up symptoms, and forcefully hospitalize her child multiple times over a small period of time. Number three, child's health worsens near caregiver. Near caregiver, due to various acts of the caregiver, the child's health worsens. But when she is taken away from the caregiver, she starts improving, because in reality, everything was fabricated. And that is what Manchausen syndrome by proxy is. I hope you understand the topic now. Next is sudden infant death syndrome, or SIDS. It is also referred to as cot death or crib death, because the death of the infant takes place while in the crib or cot. The bed in which the infant is kept to sleep is referred to as cot or crib. There is a sudden unexpected death of a seemingly healthy infant. Now let me give you a story. So the mother keeps her infant in the cot for the night to sleep. In the cot, the infant is stomach first, like this, in prone position. The next morning, the mother wakes up and sees that the child has passed away. She doesn't know why. She takes the child to the doctor does not know why. The child is taken to the autopsy expert does not know why. The autopsy findings are all negative. This is sudden infant death syndrome. The infant was healthy, but all of a sudden, the infant dies when the mom wakes up next morning after sleeping. So here, that is why the death is referred to as cot death or crib death, where there is sudden unexpected death of a seemingly healthy infant. And upon autopsy, everything is negative, but one constant finding is there. That constant finding is petechial hemorrhages in heart and lungs. And petechial hemorrhages are sign of asphyxia. I've already taught you that under the topic of asphyxia. That means somehow the child asphyxiated and died. How? Due to sleep apnea. So the most common cause of sudden infant death syndrome is sleep apnea. See, when the child is flat on the back in supine position while sleeping, if the child coughs food, it will come here. It will not enter the respiratory tract. But if the child is in prone position, belly first, then if it coughs, the food is going to enter the respiratory tract, leading to choking, suffocation, and asphyxia, and then death. That is why preventive measures should be applied when you keep your child to sleep in a cot. And the preventive measures are A, B, C. A means alone. The child should always be kept alone. No pillows, no blankets, no stuffed animals, because that might suffocate the child. The child should be kept flat on its back in supine position, not in prone position, in supine position, because in prone position there is high risk of choking due to aspiration of the coughed food. C is for crib. There should be no bed sharing. That means the baby should not be sleeping with the parents, because it increases the risk of what? Number one, the adult will use up all the oxygen and less oxygen will for the child will die of suffocation, or the adult might overlay on the child, or the child might get stuck in between the bed and the wall, leading to wedging. What are the risk factors? The boys are more susceptible of SIDS than girls. Smoker caregiver. The caregiver is carrying her child and smoking at the same time, taking away or depriving oxygen from her child and leading to apnea and SIDS. Premature. In premature child, the lung is not developed yet. So there is more chance, or it is more susceptible to become apneic and dying of suffocation. And that is sudden infant death syndrome, which is also referred to as cot death or crib death, where there is sudden unexpected death of a seemingly healthy infant. The autopsy findings are all negative, so it is also referred to as negative autopsy, with one constant finding of petechial hemorrhages in heart and lungs, which suggests of asphyxia. And yes, the most common cause of sudden infant death syndrome is asphyxia by sleep apnea. Sleep apnea is when the child is kept in prone position, stomach first. So when the child coughs, the food particle enters the respiratory tract and it leads to aspiration, choking, suffocation, and death. So to prevent that, ABC should be followed. A is alone. The child should not be with pillow, blankets, or stuffed animals, as that may lead to suffocation. B is for back. The child should be slept on its back so that aspiration, suffocation does not take place. And C is for crib. The child should be sleeping separately, not with the adult, because that might deprive the child of oxygen. And the risk factors are boys are more susceptible than girls. Smoker caregiver will take away oxygen, will put smoke around the baby, take away oxygen from the child. And premature baby, the lungs are not well developed yet.